Good day. Welcome to this special episode of EyeTV. Today, we will tackle a prevalent eye disease, glaucoma. What it is, how it is diagnosed, and how it is treated. Let's get started. So what is glaucoma? Glaucoma is a disease which progressively damages the optic nerve. Here is an example of a healthy optic nerve. And here is an example of an optic nerve in an eye with glaucoma. But what is the optic nerve? This part of the eye is responsible for communicating with the brain. Damage to the nerve can lead first to a reduced field of vision, and if left untreated, irreversible blindness. To further explain what happens in glaucoma, we can compare the eye to a sink. Somewhere in the back of the eye, there are parts that produce fluid, and in front, there are parts that drain fluid. Problems in these areas can lead to either poor drainage or blockage, ultimately increasing the innate pressure of the eye. This causes damage to the nerve we talked about earlier. As such, there are two basic types of glaucoma: open-angle glaucoma, or poor drainage of the sink, and angle closure glaucoma, or blockage in the drainage. The following are the risk factors for developing glaucoma. The most important thing to note is that patients mostly feel nothing. They are asymptomatic. However, there is a kind of disease called acute angle closure, or an abrupt blockage of the sink that we talked about earlier, which can lead to the following symptoms: blurring, pain, nausea, and redness. So how is glaucoma diagnosed? Again, most people with glaucoma do not feel anything. How would we know if we have it? Your friendly eye doctor has a few tests which can help determine the status of your eye. Again, problems with our eye's quote-unquote sink can cause increased pressure. So, there are tests in the clinic that can accurately measure your eye pressure. It is also important that your eye doctor looks at the part of the eye responsible for the drainage. This is called gonioscopy. You can either have your doctor take a look at your optic nerve or have a camera take a picture of it. There is also a test called perimetry, which can evaluate your current visual field status. So what is the treatment for glaucoma? There is medical treatment via drops, laser treatment, and surgical treatment. Basically, these three treatment options deal with the specific problems of the sink, either to weaken the faucet or to clear the blocked drain. But it should be stressed that our treatment goals are to preserve remaining vision and prevent further loss of vision, because glaucoma is a lifelong disease. Early detection and treatment is key, so consult your eye doctor and have yourself screened for glaucoma. Thank you for your attention.